basically this concept of dual plating has been there since 1991. David Helfet actually said it, and he said same thing. Medial side void collapsing, and he went in and started plating it within 6 to 8 weeks. And then which plate to use? This paper from Korea actually went through all the different types of plates, and the proximal tibia plate is one of the best fits. Sir said Philos, that's one, but the proximal tibia raft plate or the proximal tibia plate on the other side fits best and it's the strongest plate for this. And lastly, it's a fantastic paper you should look up. This is from Ganga Hospital, the last case we did. So you need to get alignment right, you need to get stability right, and voids more than 2 centimeters are not tolerated. So 2 centimeters is cut-off line. Anything more than 2 centimeters, you need to fill it up, you need to support the medial side. So when you go in for distal femur fractures, get your alignment right, get your stability good, get your void less than 2 centimeters, you may get away with more than 2 centimeters, fill the void, support the medial side, and that is where the dual plating or dual implant is a great tool. Thank you panelists, and thank you surgeons from the Dr. Tanna and Dr. Chetan Pradhan, and with this we close the session. Thank you.